Welcome back, everybody. Just because this is already Thanksgiving week, don't think you can't have a more beautiful smile by Christmas. If all you want for Christmas is a new front tooth, we can do that for you, or any tooth in your mouth with the materials, the proven procedures, the in-house lab. They're making it painless for you at the Aesthetic Associates. They're available to help you. Cosmetic dentist Dr. Todd Shatkin is back with more details. And it's funny how a lot of people will still go through life with a missing tooth in the front and have it affect them so much.
Yeah, some people don't think it's that important, but other people that see them recognize it right away. If you're missing a front tooth or missing a tooth on the side, even when you smile. You know, you don't realize the impact it has on other people.
But you do notice it. It's a funny thing.
I mean, you could
even
have
one on the side. If there's too much of a space there, people do notice it.
You can have an absolutely gorgeous individual, and if they're missing a tooth, it takes away a lot of their beauty.
It does. You know why, too, Todd? Because people, you only have one chance to make a first impression, and people will look at that, and even though it may not be fair, it may not be the right thing, they're going to say, that person is not taking care of themselves. If they don't take care of themselves, what are they going to take care of down the road? Now, if you're coming in for a job interview or something, you would be surprised how things like that make a difference in first impressions.
Yeah, for sure.
So you can fix it.
Yeah. Well, we've talked about obviously a lot of times before about replacing teeth, but I brought some pictures along, and what we're going to talk about is missing tooth. Here's an individual missing a front tooth, needing a couple crowns and a couple other teeth, but the mini implants, we can place a mini implant and a crown in less than 30 minutes, and they can be done.
Wow.
And have a tooth replaced with no surgery, no cutting, no stitches, no pain.
Wow, there's the
Here's
before
the before.
Again.
And I think that's with the crown preps on the other teeth and also the implant in place. You can see there's no bleeding.
No, there's no redness. There's no inflammation of the gums.
And that's right at the time of placement, and there we are immediately after.
So she left with that, or he or she left with that. That's amazing.
Yeah, so, and you know, it makes a huge difference.
You know, and maybe for this holiday season, maybe that's what you really want. You know, we talk about simplifying the holidays and getting something, whether it's a gift for yourself or it's a gift for your loved one. This might be the thing. Instead of another sweater or another scarf, take care of this. You'll have this for life.
Everybody's got a lot of material goods. It's always important to take care of their health and their well-being and their appearance, certainly.
And even though that person may never say it, it may be the exact thing that they want, because they're embarrassed to say it. We have more pictures, so let's go to another case and take a look. All right, here's a bottom. A
lower incisor tooth that's been, this person's been walking around without that tooth for quite a while, and finally got up the, I guess, the guts to come in and have it replaced. And again, one visit, about a half an hour, we put the mini implant in, there it is, and then cemented a permanent crown on top of it, and the patient can smile again.
Now, that might be the kind of thing where someone who is not familiar with the ease of these mini implants, that they would have to perhaps get braces and space those teeth out. You can't fill a small hole, but you can.
With the minis, you can. A lot of times, you're right, Linda. You know so much about dentistry, you could almost work in the office. You've been doing this show. We've been doing this so long, but a lot of times the roots are kind of angled toward each other, and there's not a lot of space between those roots, especially on children who are congenitally missing a lateral incisor, where they had braces to space things out, and sometimes the roots are angled. Well, that's what's so nice about the mini implants, because they're so narrow, they can be threaded in almost a very, very narrow space.
Right, so you can have just a thinner tooth put in.
Right.
And have it look absolutely
natural.
natural.
The thinner implant, the screw's thinner, but the tooth can look natural because of the
and he's ready to go. That's wonderful. What a wonderful gift to be able to give somebody. That's incredible. All right, I think we have a third patient. And we'll take a look. No, we don't? Okay, we think that's it. That's amazing.
But I want to also mention, we are, because of the holidays, every year we offer a tooth whitening special program, and we're doing this through the end of the year. It's $150 off. It's regularly $500. We're doing it for $350. So anybody that wants to have their teeth whitened for the holidays, they can call and get that. And that's the Zoom whitening, the 1 hour Zoom laser whitening.
We have a phone call. Someone would like an answer to a question that they might have about this. Welcome to the show.
Thank you.
Go ahead, please.
My name is Tracy, and I'm calling from West Seneca. And I would like to know what kind of health insurance you take for that kind of replacement on that kind of teeth.
Okay, well, thanks for the call. A lot of insurances are beginning to start paying for implants. Not all of them, unfortunately, but some are. And some will pay, if they don't pay for the actual implant itself, they'll pay for the crown that goes on top of it. So usually we can get some coverage for you. It all depends on your policy, and if you call the office, one of the nice ladies will be happy to help you figure out what your insurance covers.
Yeah, always explore it before you write it off and say,
Yep.
I can't do this, by all means, because your office is great with working with people on that.
Yeah, and you'd be surprised that the insurance company, I mean, you might think it's considered an elective procedure to replace a tooth, but actually it's a functional procedure as well, and they are starting to come around and cover that.
Yeah, and that's a good thing, because we're finding out that these things are you know, it's well worth the money, and it prevents a host of problems later on with teeth
yeah, if you
shifting and everything
exactly.
else.
If you replace a tooth, then the other teeth can't shift.
Right.
The top ones don't drop down or the bottom up and things.
So it's almost like a preventive thing where insurances are finally getting on board with that and seeing that this is a really wise thing to do
and
now.
they're realizing that it's more conservative than doing a fixed bridge, because when you grind down healthy teeth, usually those teeth may down the road need other work, root canals, fillings, or whatever. So now you're preventing work in the future by taking care of just the one
preventive
tooth.
medicine, truly.
Yeah.
Another phone call for Dr. Todd Shatkin, and you're welcome this morning. Hello.
Hello.
Hi, go ahead, please.
Yes, I was wondering how much would it cost to get like a front tooth that's missing? How much would it be?
Well, the cost for one tooth with an implant is actually less than a permanent bridge. A mini implant and a crown is just about $2,000.
Okay, but people can work with your office on payments and everything else.
We have financing. We have no interest financing programs, so you can pay 0% interest for up to a year. We also have extended programs for people who want a smaller payment. They can spread it out up to even 84 months.
Wow, that's great. All I can think of is how wonderful it would be for somebody to have that tooth replaced, especially when it's closer to the front of their mouth, and they've just been so used to not having it. Literally changes the way you look, changes your smile, changes your face. It might be just what you're looking for this holiday season.
And there's a complimentary consultation to anybody who wants to come in. So
you do it all. And remember, they have an in-house lab, and Dr. Shatkin himself has really pioneered this process. So it's well worth it for an investment in yourself. Where's it happening? It's happening at the Aesthetic Associates at 2500 Kensington Avenue in Amherst. Give them a call right now, 839-1700, 839-1700. You'll be smiling after you do. We'll take a quick break, be right back, and let you know that this segment was brought to you by Dr. Todd Shatkin and the Aesthetic Associates Center.